afternoon, everybody. I'm Rega Verma, the co-founder of Reneka App Builders. We create custom mobile apps or upgrade existing mobile apps for businesses. So whether you're looking to streamline your day-to-day operations or expand your customer base, our team can develop the right app for you. Today I have the great honor and pleasure of introducing Michelle Price. Along with being a business keynote speaker, Michelle is also a business communications strategist. She frequently works with forward-thinking organizations and creative leaders to maximize the potential of their innovative and avant-garde concepts and obtains breakthrough results. Her own company, Breakthrough Business Strategies, is a virtual CMO company. Breakthrough Business Strategies collaborates with the global business radio show Breakthrough Radio. Breakthrough Radio informs and provides assistance for startups and small to mid-sized companies on how to master the ins and outs of businesses using focused knowledge in strategic leadership, communication, and using the media to its fullest. I know we will all benefit from Michelle's wisdom and experience, so please join me in welcoming her.
I want to give a quick introduction to the panelists and our guests today, and we're going to try a little different approach, and I think you're going to enjoy it too, our conversation. Deborah Mansfield's the Director of Life Science Acceleration at Houston Technology Center. She serves as an advisor to Axion Texas, Laser Tissue Welding, and Nano 3 Bioscience, Lone Star College Montgomery Biotechnology, and Rice Alliance for Technology and Entrepreneurship. So I think it's fair to say she's got a good handle on commercializing. Lily, teach me how to say your last name.
Anovakpuri.
Anovakpuri. Ooh, I got it the first time. She is the Director of Global Programs for Village Capital, where she leads the organization's Global Accelerator Program, and Village Capital uses the power of peer support to build companies that change the world. Now, earlier in our very first panel, we heard about the product and promote trend that's happening in healthcare right now. And, they mentioned that as part of the opportunity and impact. I, for one, want to know who's going to be commercializing brain technologies. I'm really interested in brain hacking, and I'd be curious to ask the audience, who's even been reading any great blogs around brain hacking? Anybody? Wow, just two of us. Okay.
Define what you mean by brain.
Learning how to have higher performance, understanding how you can use the parameters of either
Luminosity.
Yeah.
Luminosity? Is that something?
That's a great word. Whether it's through nutrition, whether it's through learning how to activate different parts of the brain, there's different other things you can consume to work with brain hacking, which gets really interesting. So, in thinking about commercializing and partnerships today, what I have found is it's really kind of cool to take more of an audience approach. I think I probably get that because of the radio show. So instead of us talking about what we think you want to hear, we do have questions that we're going to ask our panelists and get some answers from, but I'd like to do it the other way around. Let's start with, what were you wanting to learn today from the Commercializers panel, so that we're going in a direction that's actually of most benefit to you?
How do you find the early movers, ones who will take the risk of working with a young startup?
So when you say how do you find the early movers, are you speaking to who's actually going to be funding it?
No, pilots, getting into the hands of the patients and into the hands of the physicians.
Okay, any other? All right.
Well, my world at the Houston Technology Center, what I've experienced over the last 10 years, is that we get individuals that say, I know there's a problem, and I have a solution, and I've made the solution, I've already coded it, it's already done, but I need to find money. And they come to us, and they have no clue if that fits their customer. They have not talked to a customer. They haven't talked to the pilot people yet. They don't even know where to pilot. They just know that, just like Silicon Valley, they should be able to raise money. And so part of the commercialization process is to really get them on board. I mean, we have, the Lean Canvas model that's out there right now. For others that may be dealing with other more advanced venture, it's the business plan, but for some of them, they don't even know this strategy yet. And the role, I mean, again, this is about commercialization and groups helping that is to help transform them from being that technical solution that they think they have the answer for, to actually thinking about, are they going to be a product, a technology, or are they a company? And people put contracts with companies. They fund companies, even though they want to look at the leadership, they are funding the company. So part of the role of the accelerator is to ask the questions, because TAG, they're it. They're the one without experience or little experience or a lot of experience, little connections or a lot of connections. They're the one that have to create that strategy and compelling story to make the funder fund them and to get to that pilot to deal with either its workflow, the real problem. Many of them have not even gone out and talked to the customer. So I think more than where the pilots are, in my thinking with the large organizations here in the Texas Medical Centers, can we access the actual at the level of use person to talk to us? There are organizations that you cannot find an email address. You cannot find a department information. You can't get to that nurse or that allied health therapist, let alone the doctor. So how do you do that? So we have lines at Kroger's. We're leaving our church. We're getting our car washed. And you're sitting with groups of people, and so you start talking. And you say, I'm looking to talk to somebody who's involved in X area, and it's networking into that unless you have connections with individuals high up, like calling us and saying, do you know somebody? And we say, well, before we give you that opportunity, we first have to know if you're ready to talk to that person. So any company can start. We're supposed to be so many levels of separation from which movie star is it?
Kevin Bacon, but in Houston it's Mark Nathan.
He's now in Austin. So I think that one can work that even at the very basic level to find your you have a child, you have a pediatrician, they're in a healthcare system, do you have a friend? And you can find that starting conversation, but it's going to have to be just like we've heard already today. It's about relationships and networks and finding who's going to get you to that conversation. So that's my short, long answer for you. Thank you.
So I would say at Village Capital, the problem is not finding the hospitals that are willing to pilot. I think everyone is willing to go in and try something once, and all hospitals have like an innovation center. The problem is after the pilot is over, and even if you have a successful pilot, who's willing to sign that contract long term? And so that's like what we found in terms of working with our startups. I mean, what I say is like no one ever got fired for hiring Epic, so everyone likes to go with the big behemoth in the room. But when it comes to hiring that smaller startup, even if they may have a cutting edge technology, the hospital systems are not usually willing to, they don't want to be, the first one to do it. And I think that's kind of an ongoing problem we have in the healthcare system, is we're so stuck into what works before that we're not willing to pioneer new techniques. And we have to realize that even penicillin at one point in time was new. So we kind of have to find those areas and encourage hospitals to take risks. But if you are a healthcare startup looking for someone to try out your technology, definitely go to the innovation lab. Go to the Center of Innovation. I know UCSF has one, we work with them. Boston Health has one, Brigham Women's has one. And they will, at the very least, take you into the pilot. Now the next step is probably where you'll have difficulties going.
And maybe your technology transfer office that's also tied with as a commercialization office. Some of them call them an innovation office, but many times it's the Office of Business Relationships and Partnerships.
Did that answer your question?
That's good, thanks.
Awesome. So one of the things I'd like to ask you ladies to talk about is, as we're thinking about what it takes to commercialize as well as build partnerships for digital health to be able to come to market, what do you notice are 3 things that are necessary for solutions to be commercialized in this particular area? Hi, Sally.
Again, to commercialize, we have this money path, which is from the very beginning. It's all about money, and even if you're a medical device that's going to be connected through IT, that'll eventually bring in data, or it may be your traditional decision support. You're still going to have this path for funding. And one area that could help jumpstart part of that, under the Obama administration, and some of these are starting to be retired, but there are funding mechanisms still to try to develop more robust solutions. So one could get involved with the federal programs, SBIRs, TTRs, to develop a relationship with the university where they're going to be the partner for maybe what we call an STTR federal grant, and that could start that pathway for you to get involved with, just as Emma Faust had from the startup that's dealing with children's. They had that early introduction. So I think with the money path, how are you going to validate what you have? And there's probably going to be a need for money because many of the hospitals aren't willing to pay for that validation. You're supposed to be a company, you're supposed to bring money to the table. So I'll chime in with that as one of the pieces, and I'll let my other panel.
Yeah, so on the money front, I think we've made a great step forward in that there's an introduction of 4 digital health specific billing codes. So when you go to a hospital now and you try to sell your product to them, you can say, oh, you can bill under this, because I think the problem is before hospitals were worried about, if I implement this, what is the reimbursement process? Because those didn't exist before. And I think I would put it back on the companies. Like, you are salespeople, and as salespeople, you have to tell them, like, if you use our product, this is how you can go about getting reimbursed for it, or this is how it will save you money. I think a lot of times we think that, like, if we have a great product and it makes patients healthier, then hospitals will automatically jump at it. But even though a lot of them are nonprofits, their business is still, and so we have to tell them, like, walk them down the path, give them that GPS navigation system to show them, like, this is how our product is going to help you become more profitable and to provide greater service and better service for your patients who you serve every day.
Well, now, we heard earlier that not all hospitals actually believe that when someone brings a solution to them. What have you learned has helped, if you don't already have the relationships built? Here you are, you're an entrepreneur, you talk to patients, maybe someone like Kim who's actually gone through the whole process, which is what was the impetus for her product. So she already knew from firsthand experience what was needed, but she still went out and validated it with customers. But it's like, what's a way to open that door, since they tend to be resistant as well as much slower pace than entrepreneurs are used to dealing with?
Yeah, this is where I'll insert my shameless plug for Village Capital. I think that us as an organization, we have already formed partnerships with different medical systems, including TMCX, and Lindsay is here from TMC. And so we do that work for you, and we form those partnerships for you. And the reason why those partnerships matter is because we've already tested it out, and we've had entrepreneurs, and we've sent them products that they've seen has worked within their hospital system. So they come back to us and they say, you sent us a really great product, and we've reduced the rate of readmission. Do you have any other products that also do that? And so if you don't go and become a part of the Village Capital system, which I encourage you to do, there are other accelerator programs or entrepreneurial networks or healthcare networks that you can join, and they've already built those connections. And they have advocates, because I think that's the number one thing you need, is an advocate to get you through the door and someone who knows the system. It's like when you write grants, like, that's just a big maze, and you need kind of a person to help you navigate that. And that's what Village Capital provides, and I think a lot of other accelerators and other organizations also provide that. So you don't have to do the hard work by yourself.
What's been your experience there, Rick?
Can I ask you for an example? Like which
Yeah.
hospital and which study?
Sure. So probably a really, really great example is we have a telemedicine program that it was someone who won our our program that we just finished in Boston. And in Boston, one of our partners was MIT Hacking Medicine. And so they were able to get that telemedicine startup connected with a couple clinics in Boston, as well as like Brigham Women's. They're currently piloting their program with them right now. And then Harvard, their medical students are working with this telemedicine company. And those are paid pilots, not just for free.
So when you say paid pilots, who pays for that?
The hospitals.
Wow.
Yeah.
That is completely different because I just came, the reason I was late, I had a heated argument with our vice president of some affairs who don't see the value, but they want, what we have learned in medicine is cover your ass. So you have to protect yourself. There may be a great technology out there, but they would rather be in the old ages because God forbid somebody somewhere has some leak which has absolutely no foundation, but there's a perception of it and they will be resistant. So the safety culture that surrounds the whole healthcare environment is a little bit underestimated by most of the healthcare startups. And they feel like, whoa, look at my product, it's so great, now let me peddle it out, and comes the Great Wall of China, and I'm talking about not paid by the hospital. These are startup companies that are paying the hospital, just like you would do a phase 1 to a biotech product. So it's easier for me to inject, cellular therapy into my patients, but it's very hard for me to have the patient own his own medical records. So I think our understanding of the complexity of the system is relatively low, and being from the inside, I would just say that we probably need to learn from you what you have done because it's an impenetrable wall.
I just have a quick question to all of you because in my brief experience in building my company, I'm seeing really two communities of patients and providers and clinicians. There's one community is really not quite sure how to integrate technology in the delivery of care, and that's patient, clinician, and provider. And then there's the other community that doesn't understand how it cannot be included and integrated. So what is your experience in dealing with both? Because I know today we've heard kind of these kind of horror stories, but there's also a whole community of folks who are looking totally forward, and it would be really helpful to talk to the audience about how to tap into that.
Well, someone mentioned something that we all expect. I'm a patient from time to time, I have to put the gown on and do things. And I'm of the world that I look at a screen in my house. It's a television. It's one way, right? I get information all the time. I see the future, I see opportunity, I see products, I see et cetera. So we're all forward looking at the screen all the time. So we're ready for the screen. But the actor on the other side of the screen, the healthcare organization, is not ready for that other side.
Right, and there's a
Right.
community of folks like that, but there's another community.
So you have two scenarios. I was thinking as I was listening to a number of the panels, is that you have two opportunities here. You have retrofit as a company, as a new entrepreneur. You can retrofit old, or you can build into the new. So depending on what segment you deal with, you may have an easier road. The new build-outs, the architects, the constructors of the new facilities, laboratories, hospitals, healthcare, Rite Aid, whatever, Walmart, Walgreens, etc., are looking at the new models. So my challenge at 2 o'clock in the morning, the bleeding edge of what's coming, is there may be niches for new companies, new startups, to think new. India, Africa. They're not going to copper wire. They're jumping ahead. So as an entrepreneur, you have to say, by the time my technology comes out there, in 3 years, 2 years, 18 months, am I going to hit it right? And who do you want to play with? The investors probably would like to say that is a more doable market, and you will probably have more success with new. The Texas Medical Center is amazing. We're what, 55, 56 now? That's a spurious point in the reality of the world for healthcare. I mean, it is our reality here in Houston. But the reality as a company, as a global company that will be funded by investors, has to look past what is the reality of healthcare throughout the United States, rural, 30 miles away from Texas, that's having hard times. A hurricane comes in, we have to move it on island. UTMB had to move on island because of Ike. You know, they couldn't deal with clinical studies because their systems on island weren't ready for what was in the hospital, but the hospital was closed down because water had completely engulfed the first floors. So I would say to the entrepreneur, look to the new edge. You don't have to stay with the old. Yes, Epic will eventually catch up. Are you part of that or not? Or, I mean, I pulled off of the internet something, a 2003 report. Health IT is an ultra-large scale system and it's an ecosystem. Talk like this, reports like this still that are out there that are talking about systems talking with systems, and it may not just be, the EHR is a data set. It's going to have to deal with other things. So I would say force the vision of what could be and find that appropriate investor who's going to believe in that vision and deal with them. And it's hard, it's not easy. The money part is not going to be easy. And so when I brought up about the federal government money, because it still exists and still good for validation, we had a local company doing a technology out of UTMB Galveston. The company's called Arcos. They work with the military for the first FDA cleared decision support software. And they got it cleared. And they're now in 7% of the burns beds. They're in the beds, dealing with bed patients, 7% in our country. Out a year and a half, they have 7% of the beds of the United States using their product. So it's possible, but you have to look at different ways. So that's my 2 cents on this.
Simmer, I had a quick question for you. I mean, sort of being an internal champion and MD Anderson, I mean, are there certain products that are easier to get through, you know, to get people to pilot or to use, or do you think it's sort of like all products?
Well, we have currently two healthcare startups that are actively getting piloted, but the model is again the same. Phase 1 to biotech companies, and they pay X amount. There's an actual principal investigator. There is, some level of stats around it, so it gets published out there. And what is easier to do is when it is positioned properly. So you can either have metrics that are around quality of life, because that is something that everybody is being pushed upon. So after the Obamacare or the way the reimbursements are being made, now there is a great emphasis in terms of patient satisfaction. So if there's anything that is able to improve their satisfaction and it's a patient-reported outcome, it's a completely different approach. Now, if your product is solving, better billing, or it's based upon imaging or something, then that comes into a completely different technical know-how. So at this point, at least for healthcare IT, it's been divided into 3 basic products or 3 categories. So one is that is completely consumer-oriented. So the IT product can be marketed directly. You don't have to go through the hospitals. But in general, what we have seen is that, let's say if there are 5 products out there, and one is marketed, they say it's great, they have got great PR on Forbes and whatnot. The other product is not so highly taken up, but it gets endorsed and or piloted at a place like Anderson or Stanford, then the adoption of that product is much higher. So one of the things that I feel, at least in talking to startups, is that you can have the prettiest product, but unless and until there is an adoption, you're set up for failure. And penetrating the external markets, it's even harder than what you think in the United States, because US consumer is much more risk taker than if you go to India or China. So, you've got to figure out what your bandwidth is. And then you have to have a know-how, inside know-how. The worst thing is when you have computer programmers, and I'm not going to name a company, there is a very successful company in terms of an outsider because they have been able to capture a big amount of venture capital. But when you look at it in terms of the physician's perspective, it has a fatal flaw because it's based upon gaming physicians' time. And people don't realize sometimes that, doctors are a different breed because they're either ADD like me or they are completely Asperger's. Like you can't have, this is not,
Somebody write that quote down.
but this is not a community who's going to hang out, there's no Facebook for doctors. Like nobody wants to hang out with another doctor. Frankly speaking, there are other commitments, after billing and dictations and this and that. You don't want to go to a space that's going to be like socialization. It doesn't work that way. So I think you have to first understand which specific segment. So I told you the patient is one, the physician is one, and the third one is actually the relationship between all these in terms of diagnostics or medical imaging, better interpretation, so on and so forth. So I think understanding of the market in healthcare IT is very important. Right now this field is extremely hot, and I think that definitely the models are needed. But I think you have better luck in terms of adoption in private clinics. Smaller clinics, private hospitals, people who have decision-making ability. So right now, when you say pilots, they are, having better adoption in the community practice. So if you want to approach a systematic one so that you have greater adoption, approach things like US Oncology, who are completely private. If you go to MD Anderson, the bureaucracy here is so onerous, it's just really, really not good. And the argument that I came from was not good. Sorry for that. But yeah, that would be my advice, but get the insider's perspective and, get people to take pot shots at your project.
So I think it was really interesting you talked about, and I've also been noticing that the U.S. Army tends to be taking a lot of real forward-stepping approaches to everything, to who they bring in for training, to the things that they're doing internally as well as what they're putting out internally. So you have an opportunity to maybe do something with someone inside of the government that is very forward-stepping and thinking, or similar you're saying, go to someone smaller that you'll have a better opportunity of potentially being able to run a pilot, get some validation, and then you can open additional doors from that. When we look at it from that perspective, are there any players that may be missing from the table that will allow us to have better adoption rates?
I think I said the private practice would be an easier. I'm not sure if it is better. I think if the 80-20 rule exists anywhere, and then 20% of the physicians in the academic sector are pretty much governing the practices of the 80% of physicians in the private practice. So if you are able to penetrate the Chinese wall, go for it, because the amount of effort that you're going to deploy behind going after private practice or the bigger initiatives will probably amount to the same. But it is an easier path. And one way would be that you get your pilot or you get preliminary data in the private sector, and then you go and say that, look, this guy is using it, so why don't you use it? And there are some metrics around it because instead of 5 nurses on the phone who are being paid $90,000 a year, who are on the phone trying to call Mr. Smith, who is living in McKesson or somewhere else, she can actually do her job. And then, those kind of solid metrics can be presented, and then, you need an internal champion, either physician-wise or a nurse practitioner or somebody in the medical personnel who will see a virtue in it. And there are 2 ways in which you can, I would say, entice the academic sector. One is money, because everybody wants grants and everybody wants funding. And you don't want to be like out there, oh yeah, I'm going to use this healthcare IT app and I'm going to do it in my, I don't know which time. And the second one is that publishing. So right now, NIH itself has rolled out 2 major grants. One is out of 1, one is out of 21. in which they're looking at integration of mobile technology into better patient care. So if it resonates with that, then it would have some level of adoption as well. And this market is so mature, so exciting, that anything that's being done differently will be looked upon as novel. And if you look at the funding lines for NIH or any of these funding bodies, they are all looking for that newer thing or better thing. So I would say, you got to play the game that is required, but yeah, there is easier path and then there is difficult path, and then, there's complete unknown. And, you also run the risk of the fact that your app may not be that good, what if the results are not? Then you run the risk that somebody will publish that out there. So all those, but it leads, as an entrepreneur, it gives you the chance to iterate before you burn through X amount of dollars of your investors and then they frown upon you. You can actually get that instant feedback that, okay, I need to probably change it right now, and then, maybe present a better product in the end, which will be adopted. So, sorry, long answer. Do you have anything you want to add to that?
No, I would say that the one player that is missing is the customer. I think a lot of times we build a product in a silo, and so we encourage our entrepreneurs to go out there and actually bring in a customer. So for instance, a lot of folks build a diabetes app, and I think of my dad who's 70 years old and has a hard time turning on our new TV that we got him for Christmas. And you want him to use this multifunction like smartphone app. He doesn't even own a smartphone. So we kind of challenge the assumptions that our entrepreneurs have of what your typical user would do by bringing in those people in a forum we call like our customer forum, where they actually get to test out the app, and there are different stakeholders, whether it be a nurse or a 70-year-old man with type 2 diabetes, can actually have that hands-on experience. And then we encourage them to go and iterate before they go out and pitch like large organizations, so they can make that failure internally where it's safer, instead of like going out, getting a grant, doing this large research project and then failing like majestically and horribly. So that's kind of part of what we encourage. Don't forget the customer. Don't be a solution looking for a problem. Like, identify the problem that you're trying to solve. Make sure it's actually a problem patients have, or doctors have, or nurses have, and then actually create the solution around that.
Sure, and I always stress to companies, whether or not I'm working at the center or just in the world at large, is that you have to look 360 at your customer. When you're dealing with your solution, you can't assume that once, oh, thank you for your purchase order and great, goodbye. You have to know how you're going to implement this. And how are you going to help them integrate it into your system? So there may be a missing component of this, is understanding that you may need to partner with others that have pieces and parts that are already working well. And some of those people actually may already have some of these relationships in the organizations you're trying to reach out to. So by partnering, and rather just going yourself, I think a lot of our investors would like to see that, because it's less cost. The company doesn't have to build it again. That may be another plus, is to partner up. Because I had an event just this past Tuesday, and these were companies from this region. They were the first time many of them meeting each other, and there were triplets there. It was like they all got the same idea, and they're all coming at it from a different angle, but it's the same solution. So what do they do? Do they all come and charge forth to MD Anderson, and somebody's going to throw downstairs and say, "You're on the top stair, I'll take you"? Or are they going to say, well, is there something that we can work together, make a more robust solution? So I think it's also partnering, because there's convergence, the big white wall of enterprise. Some of it's going to be Epic, some of it isn't. You're one dot. Where's the other dots around you, and how are you going to connect to those? So that's another thing I throw out to entrepreneurs as it commercializes. Look at the ecosystem around you, where your dot's going to fall on that wall. Is there somebody already out there that's doing it, has partnerships? And you have a part of the pie versus no pie, right? What was that? I'd rather have a piece rather than none. Yeah. All right. Thank you.
Thank you, ladies.
All right, thank you very much.